Cleaning involves more than just keeping up the appearance of a tidy practice. Cleaning is essential in helping to keep patients and staff healthy. We often toss around the word cleaning without thinking of the actual meaning. What does it mean to clean? Cleaning is the physical removal of foreign as well as organic materials. This can include dirt and dust, as well as blood or secretions. Cleaning is accomplished with water, cleaning products like soaps and detergents, and some good old-fashioned elbow grease. Cleaning products come in many forms, such as liquids, powders, and sprays. Regular cleaning of high-touch surfaces is paramount. Door handles, walls, tables, keyboards, toys, and books can all accumulate lots of grime in a very short time. Make sure the practice of thorough and regular cleaning is a big part of your practice. To learn more and download a cleaning and disinfecting checklist, go to aap.org/Project Firstline, created in partnership with support from the CDC. Okay, great. The office looks nice and clean. But is it disinfected? If it's clean, it's disinfected, right? What's the difference? While cleaning physically removes dirt and grime from surfaces, disinfecting actually kills harmful bacteria and viruses on surfaces or objects. Once an area has been cleaned with soap, water, or any additional detergent, it needs to be disinfected with an EPA-registered healthcare disinfectant. Disinfection can happen at the same time or after cleaning, depending on the product. Disinfection is never done before cleaning. Always follow the instructions on the product label and pay close attention to the amount of time needed to kill germs. Cleaning and disinfecting go hand in hand and are both important to keeping staff and patients healthy and safe. For more information and to download a cleaning and disinfecting checklist, visit aap.org/Project Firstline, created in partnership with support from the CDC. You're working hard to keep the practice clean and germ-free to keep patients healthy. But what about you? Use of gloves, gowns, and masks offers you a layer of protection from contaminated surfaces and chemicals used in cleaning. When cleaning and disinfecting, you should always wear gloves. If you need to clean up liquid hazards that might spill or splash, such as urine or other bodily fluids, make sure to wear gloves, a mask, gown, and even eye protection, just in case of splashes. Don't forget to remove your gloves and clean your hands when moving from a soiled to a clean task. Wearing the right PPE while cleaning and disinfecting can help to keep you healthy while you are ensuring the health of patients and staff. For more information and to download a cleaning and disinfecting checklist, visit aap.org/Project Firstline, created in partnership with support from the CDC.